So let's move into the clinical phase. At the end of this session for clinical, you all will understand how you can assign goals and interventions to a patient, how you can manage those interventions, and also how you can document progress to goals. Okay? So let's go ahead and jump back in. And we were looking at reports admin. I'm going to make my screen just a little bit bigger for you all. Hopefully that helps there. I might have to adjust that. So I'm going to go into my Hotbox. And what I'm going to do is I'm going to show you, first of all, what your OASIS will look like once progress to goals is turned on. So I'm going to go to Rebel Wilson. And we're going to go ahead and take a look at her start of care. Okay, so here's the OASIS. It's been assigned to me. I'm going to go and look at Rebel Wilson start of care. What you're going to see now is you're going to see this button at the bottom, and this is in a pink area. And so within our OASIS, it's color coded, and anything in pink, for the most part, it all flows over to create and build out your plan of care. So I'm going to go ahead and click into goals and interventions. And this is a completely new OASIS. I have yet to work with Rebel. What you're going to see is we will see a tab that says unmet and a tab that says met. So you're going to see that we have currently no goals that are assigned to Rebel Wilson. Okay. And what you will be able to do from a clinical standpoint throughout your assessments along with your therapy evals is you'll be able to assign new goals and interventions. Okay. So what we're going to do is we're going to be able to click on this new goal. And remember, I'm in an OASIS start of care for skilled nursing. So when I go to new goal, I am only going to see goals that are specific to skilled nursing alone. Okay. So what we're going to see is this is all information pulling from that library that we've built or the library that your administrators customized. You'll be able to see here are my list of goals. I could, if I wanted to, filter by problem area, and remember whatever goals are tagged to that problem area will populate. We'll also be able to see that if any of these goals do have an intervention off to the right, it's going to give me a listing of how many of those interventions are tied to this one goal. So what we would be able to do is maybe I want to select integumentary, and I want to also select pain reduction. So I know that that's going to have 6 attached interventions, and I believe this one has 1. Okay, and I can also scroll through these, but again, you're only going to see skilled nursing because we're within a skilled nursing assessment. Okay, so I'm going to go ahead and I'm going to hit continue so I can drop that in. I'm going to select one of these here. If you notice skilled nursing, pain, understand use of medication, says there's no interventions. Typically, you would want to see that there are interventions added there, but I'm going to select one just so we can take a look, and I'm going to hit continue. So I've selected 3 goals all at once, right? And what I'm able to see is my goal is now available for me to work towards, okay? So first of all, I'm going to see assign goal. And this one is in regards to staying infection-free during 60-day episode. So I can see that there's some information I need to go ahead and fill out. So the target date for meeting this goal, again, the great thing about this is we're able to make it specific so we can make sure are we actually able to accomplish that goal within that specific measurable period of time, right? So really great for outcomes. You'll notice you have a month and date, or if we wanted to make sure this is a target date by the end of the episode, the really great thing is the system is dropping that date in for you. You don't have to constantly go back and forth, because I know sometimes I'm like, what was the last day of the episode again? I just can't remember. You're doing so many things. And so Kenzer's really made that easy for you. Okay. Now at the same time, if I didn't want that target goal to be met by the end of the episode, I can see that I have an option for long-term goals or short-term goals. So this is really great because this is something that we know a lot of therapists like to look for. I want to be able to put in my long-term and my short-term goals. Kenzer really listened and they were able to add this feature in. So if this is a short-term goal, I have to put in the date that I want to make sure that goal would be met by. and maybe it's going to be during my 60-day episode, it says, so obviously that would probably be a long-term goal by the end of the episode. Okay, but again, if this was short-term, we can select that as well. Notice it does tell me all fields are required, so I can't assign this until I actually fill this out. Here I'm going to see the interventions that are attached, and it says skilled nurse to instruct. Is that going to be patient, caregiver, or both? So again, I can just come in here and answer that piece of that field of that particular statement. And then increase in drainage, foul odor, redness, they want us to enter in a number, right? On a scale of 0 to 10, you know, what do we want that number to be for unrelieved pain? So I would say maybe unrelieved pain greater than a 7, let's just say. And if I'm done with this area, I can go ahead and assign this. Now notice if I needed to and there was multiple, like we'll see down here, I can decide which interventions will remain and stay tied to that goal. Okay, so let's go ahead and finish this first goal out. I'm going to assign that one in my OASIS Start of Care. And now I'll see that that one goal is assigned. I can go ahead and finish out the next goal. Again, if that's by end of episode, I can go ahead and enter in that date, right? And then again, just assign that. I'll also be able to see further down, here is the new goal of pain reduction. Maybe that's a short-term goal, right? I'd be able to put in the day, let's say the 7th, and then patient will achieve pain less than, let's say 5, within, maybe that was 4 weeks I put, right? I'm just estimating here. And what I'm able to see is I see those interventions that were attached from the library, and these are the ones that are automatically populating because the administrators set these up to flow in the library customization portion under phase 1. So if I feel that these 2 interventions at the top, for whatever reason, don't pertain to my goal, notice I can click on that X and those just drop away. I would be able to finish out answering these texts. So not greater than, and I'm just putting in numbers here, and then entering a date. So I'm just putting in those cues that I need and I'm assigning it. Okay. What I'll be able to see too is if I didn't mean to maybe attach this goal, I'd be able to delete it. It says removing this goal will discontinue any assigned intervention. So you want to make sure if you delete that, you haven't performed any of those interventions. Okay, once these have performed, you cannot delete that. You would actually have to go into an order to discontinue, and we're going to see that. Okay, so this is what you'll be able to work with. And again, notice now I've assigned 3 goals. So now at the top tab, it says 3 are unmet goals, and I still have 0 met goals, and we have yet to really document towards any of these. Now, what you'll see here is, for instance, this particular goal did not have an intervention tied, and this is where your clinical staff really gets to come in and make this specific and measurable, because not every patient's situation is going to be the same, right? They're not all cookie cutter. So if they needed to, they could click on this new intervention, and then they can still search from within the skilled nursing pre-built library intervention options. So this is all pulling from the pre-built library. I can select one of these and continue. You'll also see that clinical, you'll have an option to select use free text. If that's the case, a pop-up box is going to appear, and you would be able to customize this specifically for your patient. So you're not using an actual built-in or pre-built intervention. You're coming in here and you're creating your own. So maybe we could put in caregiver and patient will be able to demonstrate filling the medication box for the week, right? For pain meds of C2, right? And then I'd be able to assign this one. Because this is going to be a free text intervention, once that's loaded in, you're going to see FT here within this particular intervention, meaning that was free text. It's not an actual intervention that was already built in the pre-built library that was selected. It was one that they came in and customized for themselves. Okay. What you'll be able to do too is you'll be able to see that for these interventions, we have perform, So we would be able to come in here and perform towards those interventions. So this one says patient will verbalize understanding. If I click on perform, then that's going to open up additional boxes for me for this one intervention. This would have been performed on, if that's patient, caregiver, right? I can select a checkboxes, check all that apply. What was the result? Did they verbalize understanding? Did they return demonstration? Maybe they need reinforcement, right? And so I'd be able to say, we'll continue to work with both patient and caregiver for medication usage, right? Whatever that may be that you're documenting to, you would be able to enter that info in. This says optional, but you want to check with your agency's policies and procedure. Your administrative staff may always want you to put in an evaluation note, okay? So make sure you're checking with them for that guidance of what they're expecting. I can go ahead and hit submit. And what we're going to see now is, if you notice on this intervention, it's at 0 because we haven't performed it at all. However, within our assessment here, we did perform this one intervention once, and so now I will see a 1 towards it. I've already performed it, so I can't perform it again within this note, but if I need to edit that, there is an edit pencil, and that's just simply going to bring back what we just entered in if you need to maybe add to that or change that up if needed. Okay. And really everything, as you click on assign or perform, that's all being saved. So this is kind of how you'll be able to add in those goals throughout your assessment. So your OASIS assessments along with your therapy evals. Okay. So we'd be able to see that there. I'd be able to click on the bottom and I'm going to hit return. What we're going to do is, this is an kind of a out of the box, a new assessment that I had assigned. Let's kind of fast forward and we're going to take a look at another patient. So let me go back to my hotbox, and we were looking at Rebel Wilson. I'm going to look at Mr. Bob Marley here. He has an OASIS that I started and then I went ahead and reopened. And we're going to take a look at an actual OASIS that was already done. Okay, so we're going to fast forward, and I'm looking at Mr. Robert Nesta Marley's OASIS. What you're going to see is, if I go to orders for discipline and treatments, you can tell that this is an OASIS I've already worked through. At the bottom, I'm going to select orders for discipline and treatment. And this is going to give me at the bottom a history of all of my goals and interventions for this one patient. So we'll be able to see each of the goals, what are the target dates, if there's any progress, and we're going to talk about that here in a minute. We'll be able to see those interventions, if they were performed, if there was one that was added. So you'll be able to see all of that info here. Now, this is an OASIS that I have yet to submit. So if you need to, I'd be able to click into edit and maybe select any of these areas, even respiratory. It doesn't really matter if you're wanting to document to respiratory. You don't have to be in the respiratory section to document to that. You could really wait even till the end to document all of those, because when you go into goals and interventions, that button is going to basically taking you into the whole overview of all of the goals. And of course, when we saw new goal there, we'd be able to see that you can document to any of these areas. It doesn't have to be in that specific section anymore. Okay. So what I'd be able to see here is I'd be able to expand all my goals, and currently I have 8, yet one of them has already been met. So we're really being able to visibly see that here at the top. And what I'm seeing here are skilled nursing goals. At the bottom, I can still see other discipline goals. So for instance, I can see my physical therapist has already began working on their therapy eval. And so those goals are also there for me to view. So that's really great for care coordination. You don't have to no longer leave the node and try to go see the print view. Everything's going to be all in one view for you. So that makes it nice and easy. We'll be able to view those goals, but of course we wouldn't be able to address any of those because that's still specific to therapy, PT. And so we're in a skilled nursing OASIS. So I can see that we had a goal. It looks like JLo went ahead and documented to this for physical therapy at 20% for that short-term goal. Okay, so I can just open that up, or I can collapse it all there. But that's really great because, again, that's really helpful for care coordination. At the top here, we're able to see these other 6 goals. And if I wanted to, I can go ahead and expand all of them or one at a time. And this is just showing me, for instance, this is a short-term goal. It gives me the initiated date, the target date. I can see the date, the clinician who it was assigned to, what they detailed towards, and that there was no changes for skilled nursing. Okay. I'd also be able to mark this intervention as completed if I need to, or perform it. So obviously you'd want to perform that because right now this has yet to be performed once. I can tell because for this intervention there is a 0. So I can go ahead and hit the perform button like we saw, document that it's maybe verbalized, and then put in my notes. Again, check with your agency as far as what they want you to document, if that is going to be optional or if that's going to be required. And that way I would be able to say, you know, yes, we assess that. Now that's probably going to be a goal or an intervention that we would wait towards the end. But you'd be able to see that you could mark that intervention as completed. And I'm going to do that here in a second. Let's take a look at the next one. Here we can see this was a free text. They free typed this particular intervention. So I could go ahead and if needed, I would be able to perform this. Again, document towards it, put in my notes. And I'm just putting something in here kind of for the sake of demonstration purposes. Submit that. And if that was appropriate, then I would say this intervention has been completed. And it's going to tell me if you make this intervention completed, marking this intervention as completed will inactivate the intervention. A discontinue order will not be created. And remember that this cannot be undone. Are you sure you want to continue? Okay. So of course, if I didn't need to, I could hit cancel. But if in fact that was an intervention that was completed, I could go ahead and hit continue on that there. And so I'll be able to see that that intervention has now been completed for me. And it'll show the completed date and it was performed one time. Okay. Same thing here. We'll be able to see a goal, open that up, and you'll be able to see where you can also document towards progress of the goal. So here you have some options. You can decide whether the progress is improving, it might be declining or unchanged. You may want to check with your agency to see if they would rather have you document to a percentage. But whichever option you select here that your agency wants you to be using to document towards, the system is going to ask you to put in a progress note. As of right now, that's optional. And so again, check with your agency's policies and procedures. They may say, you know, we need you to document a note every time. Even though we know it says it's optional, you need to be documenting specific information. Okay, so definitely check with them on what they want. So that way you make sure you're following policy and procedure. Okay. So that's where you're really able to see your notes within the OASIS. And keep in mind, we're going to go ahead and take a look at some of the skilled nursing notes. You cannot create new goals or new interventions from your regular skilled nursing note. So let's go ahead and go back to, I'm going to go back to patients. And let's look at Mr. Marley again real quick. So here's his skilled nursing visit note. I'm just going to log into it. I know you would technically go from your hotbox. So I'm kind of going a roundabout way. But I'm going to scroll down here. And at the end of your nursing note, you'll be able to see that summary again. So everything's still flowing forward for care coordination. And then, of course, if I needed to document at this visit, I can go to my goals and interventions, and I'm going to be able to see everything that we just saw, except here, notice, no new goal. I can't create a new goal, right? That's only done within the assessments or an order or your therapy evals. So really, in your skilled nursing and your therapy notes, you're going to be able to document towards those interventions and goals. Okay. And again, you'll still be able to access other discipline goals. The really nice thing about Progress to Goals 2 is that if your therapy goals are added within the first 5 days, then those are all going to populate to your plan of care now. So that's going to be extremely helpful for everybody to be able to know, oh, all my therapy goals, even though my skilled nursing OASIS is completed, now my therapists within the first 5 days are completing their evals, will still be able to go into an OASIS, onto our plan of care, and those particular goals and interventions for therapy are going to populate forward to that plan of care, okay? So that's how you're able to see everything within the skilled nursing note. And again, we've kind of already taken a look at this. You still can document towards the intervention. If you're not going to document or assess that goal, then you can defer, and at least one of your goals has to be addressed within your skilled nursing notes, okay? So I'm just going to go back. That's our nursing note. Let's take a quick look at our PT eval. So here we have PT. I'm going to go into the details, go to view, PT eval. Again, very similar to the nurse's note, except it's an eval. Of course, we know that. But at the bottom, we're going to see here's the goals for therapy alone, right? They can only document to PT. They're going to go into goals and interventions. And when they go into goals and interventions, they'll be able to, this is a therapy eval, so they will be able to add in new goals. And just like we saw before, it's only going to pull in, instead of skilled nursing, when we were in that OASIS start of care, here we're in PT, it's only going to pull up PT goals for me. And I can see which ones already have interventions. This one I can see is already assigned to my patient. So I'd be able to add goals just like we saw before. And then of course, for care coordination, I'm still able to view all those other nursing or other discipline goals. So that makes it a lot easier for me. Okay. And again, if those are done with, the evals are done within the first 5 days, then those particular goals and interventions do flow over to your plan of care. So let's go ahead. Speaking of plan of care, let's take a look at that. Here's our 485. I'd be able to go into file. If I review my narratives and statements, notice here we have skilled nursing, and we'd be able to see that there. I'm going to go back to my 485 menu. Let me change my OASIS and just double check that. Refresh that there. Let's go into the print preview, and I'd be able to see all of those goals listed in there. Okay. So that makes it really, really nice and easy. You can read them. The goals are listed for you. Just as we saw, we'd see interventions. So you'd be able to review that. Let me go back to the episode and let's take a look at an order. So one thing that you need to be aware of is when you go to file new order from a patient's chart, this looks like your normal order. So in order for you to be able to see the progress to goals feature, you must go down and hit add order. At this point, we've just kind of created this order, but it's not tied to our patient's chart yet. So we tie that to the chart once we actually hit add order, and that makes sense because that's how we actually assign it to ourselves and it flows into our hotbox. So I'm going to go ahead and hit add order. What you're going to see once you've actually assigned that order to yourself is that you'll be able to click into the drop down for your specific discipline. You'll be able to go to goals and interventions, and then that's going to pull forward that goal and intervention dashboard or kind of dynamic progress of what we're seeing, right? So now I can see this is for PT. I can add a new goal. I can open this up. And if I needed to, I can also perform this particular intervention. So I'd be able to edit this. And again, if I had a new goal, I would only be able to add that within my assessments or my orders. So you'd be able to see that there. My goal is met. I can mark that as met. I can also see that for care coordination, I would be able to continue seeing everyone else's goals. And you'll also notice here I can discontinue. So you won't be able to discontinue within your routine notes. That would have to be done from an order, a therapy eval, re-eval, okay? So you'll be able to see that there. Again, make sure you look at those orders and you have to assign it to yourself.